A collective sigh of relief aboard a cruise ship that docked in Texas after a passenger tested negative for Ebola. A Coast Guard helicopter was dispatched to collect a blood sample from a woman who had handled specimens from America's first Ebola patient, Liberian Thomas Eric Duncan, who died earlier this month in Dallas. The episode points to mounting fears and evolving health protocols to deal with the virus. Last week, America's third Ebola patient, Dallas nurse Nina Pham, was transferred to the nation's premier health research facility, the National Institutes of Health near Washington, for treatment. NIH infectious disease specialist Anthony Fauci.
I think this idea that every single hospital can take care of a seriously ill Ebola patient right now is just not true. We don't want to get people to think that any hospital, community hospital, is totally equipped to care for the patient.
Fauci echoed President Obama's attempts to calm an increasingly alarmed American public.
This is a serious disease, but we can't give in to hysteria or fear. Now, even one infection is too many. At the same time, we have to keep this in perspective. As our public health experts point out, every year thousands of Americans die from the flu.
But a growing chorus of critics, including Republican and Democratic lawmakers, want stronger measures to isolate the United States from African nations where Ebola has killed more than 4,500 people. Congressman Fred Upton.
I'm going to encourage the president to really put in a no-fly zone from that region of the world, particularly for folks trying to travel here on a visa.
President Obama said stopping flights to and from West Africa could make the situation worse by disrupting the flow of supplies and health workers to affected regions and causing passengers to go through third countries and possibly evade screening for Ebola. Michael Bowman, VOA News, Washington.